Dr. Vijay Negalur, consultant diabetologist practicing at Thane. Today I'm going to discuss with you about the heart failure pathophysiology in patients of diabetes. You all know that this complication of heart failure is often forgotten and is quite frequent, and quite often it is fatal. But still, it is not paid much attention to. Even since the age from the Greek area, the heart failure was known, and they diagnosed these patients with the edema of feet and exertional dyspnea. Eventually, Hippocrates also mentioned about the heart failure, and then it was William Harvey who established the circulation and made us understand about the hemodynamics of the cardiac circulation, and it was the heart failure was identified somewhere in about 1817, where heart failure was diagnosed in a patient of mitral stenosis. Diabetes and heart failure are the two sides of the same coin. If you see patients of diabetes, they have increased sympathetic activity, increased neprilysin activity, and also increased activity of the aldosterone production. And because of these common things between diabetes and patients of heart failure, these two are supposed to be the two sides of the same coin. Heart failure eventually leads to progression of the microvascular disease and also the progression of subsequent and further heart failure. Heart failure is common in patients of diabetes because of the high levels of free fatty acids. These excess amount of free fatty acids can have deposition of the epicardial fat, and this epicardial fat produces inflammation in the myocardium and therefore producing inflammation, and you have heart failure. We all discuss about heart failure under two headings, one with the preserved ejection fraction, the other with the reduced ejection fraction. It is easy to remember that heart failure with preserved ejection fraction is common in female patients, and that with reduced ejection fraction is common with the male patient. The pathophysiology to understand between the preserved and a reduced ejection fraction is that those patients with obesity and a high insulin resistance have a decreased amount of protein kinase G, and therefore there is evidence of hypertrophy of the ventricle, and this is the obesity-driven heart failure, which is called as a preserved ejection fraction. The other one is patients with male patients who have high amounts of advanced glycogen products, and that because of increased the oxidative stress, they have increased amount of fibrosis and thinning of the myocardium, and therefore dilatation with reduced ejection fraction. These two common conditions are seen in patients of diabetes. I did mention about the sex in which the systolic failure versus diastolic failure is common. As I mentioned, that female patients have more of diastolic failure and a male patient have more of a systolic failure. It's important to remember the treatment of heart failure is very rewarding, and the guideline-directed medical therapy is essential to see the patient live longer despite of heart failure. So therefore, it's important to identify the patients of heart failure and evaluate them heart failure and then treat them accordingly so that they do not have increased mortality. As we know that those who do not receive guideline-directed medical therapy, large number of patients succumb, and the 5-year mortality is as high as 70%. So therefore, identify, evaluate and treat early patients of diabetes with heart failure. Thank you very much.